Diabetes is a chronic health condition that affects how your body turns food into energy. Most people's bodies naturally produce the hormone insulin, which helps convert sugars from the food we eat into energy that the body can use or store for later. When you have diabetes, your body either doesn't make insulin or doesn't use its insulin well. This causes the level of sugar in blood sugar to rise. High blood sugar levels cause serious health problems over time. In this video, we will be focusing on type 2 diabetes because it is the most common type of diabetes. 1 in 3 adults have diabetes. 1 in 8 adults are pre-diabetic and don't even know it. With type 1 diabetes, the body can't make insulin. If you're diagnosed with type 1, you'll need to take insulin every day to survive. With type 2 diabetes, your body doesn't use insulin well. The good news about type 2 diabetes is that it can be prevented or delayed with healthy lifestyle changes. With prediabetes, your body may not be able to fully use insulin, or your body may not make enough insulin to keep your blood sugar levels in a healthy range. People who have prediabetes have blood sugar levels that are higher than normal, but not high enough for a diagnosis of type 2 diabetes. No matter where you are with type 2 diabetes, there are some things you should know. Even though it can be prevented or delayed, and while some people control their blood sugar levels with healthy eating and exercise, others need medication or insulin to manage it. Regardless, you have everything you need to fight it. This disease needs to be diagnosed by a doctor or qualified practitioner. Let's talk about its effect and how type 2 diabetes is diagnosed. Type 2 diabetes most often develops in people over age 45, but more and more children, teens, and young adults are also developing it. Diagnosing type 2 diabetes requires a series of lab tests that will be ordered or performed in your doctor's office. The diagnosis often is made during an annual physical or checkup. The symptoms of diabetes are generally hard to pinpoint, but there are several signs that frequently coincide with high blood sugar, such as frequent urination, frequent thirst, excessive hunger, extreme fatigue, nerve tingling, blurry vision, and cuts or bruises that are slow to heal. If you can relate to any of these symptoms, or if you have a history of diabetes in your family, it's important to consult with your healthcare provider and get a confirmed diagnosis. Do not attempt to diagnose yourself by using over-the-counter testing equipment. Let's discuss what you can do to manage your condition if you are diagnosed with diabetes. Living with diabetes can be tough at times. Getting older can make the process a bit more challenging, but it's not impossible. Being over 50 can also increase risk for certain complications, but with persistence and care you can mitigate those risks. Unlike many health conditions, diabetes is managed mostly by you, with support from your healthcare team, family, and other important people in your life. Again, managing diabetes can be challenging, but everything you do to improve your health is worth it. The first place to start is with healthy eating and being active. Even if your doctor prescribes insulin or other injectable medications to help manage your blood sugar, you'll still need to eat healthy and be active. Eat a healthy, balanced diet. Plan your meals at regular times to help your body control blood sugar levels. Snacks should be healthy, limiting sugars, sweets, and high-fat foods. You must maintain a healthy weight. If a person is overweight, a loss of weight of only 5 to 10% of total body weight significantly reduces diabetes risk. Focus on preventing and treating common diabetes complications. Beyond managing your blood sugar, it's important to keep your blood pressure and cholesterol levels under control. Schedule annual physical and eye exams. Every year you will need to be screened for possible signs of kidney disease, nerve damage, vision problems, or heart disease. You will need to be acutely aware that diabetes can cause degeneration of every major system or organ in your body. Take care of your hands and feet. Diabetes can cause neuropathy, a condition that makes it harder to feel a hand or foot injury. Wounds heal much slower in diabetic individuals. An injury to the foot can quickly become infected if unnoticed and untreated. If it is necessary to take medications for blood sugar control, work closely with your doctor and care team to meet your individualized blood sugar targets. You will need to work diligently to stay within the appropriate ranges. Especially for some older adults, the complications of low blood sugar levels are greater than for complications from slightly higher blood sugar levels. We all understand that stress is a normal part of life, but it can make managing diabetes difficult. For diabetics, regular physical activity, getting enough sleep, and managing stress levels are crucial. Talk to your doctor and diabetes educator as soon as possible if managing stress is an issue for you. Depending upon your circumstances, in addition to annual checkups, you may be required to make regular appointments with your healthcare team to be sure you're on track with your treatment plan. With a better understanding of your role, now you can take charge to prevent or delay type 2 diabetes and its complications. If you already have diabetes, be sure to see your doctor regularly. Diabetes education never stops. Every year we learn more about diabetes self-management, education, and support services that can help you manage this disease. We have enjoyed bringing you another video, and thank you for watching this to the end. The tips and suggestions mentioned in this video are for general information purposes only, and should not be construed as professional medical advice. It's important to consult with your physician for medical advice regarding prediabetes, type 1, and type 2 diabetes, to ensure that you have a clear understanding of your condition as it relates to this disease. Always consult your doctor or a professional healthcare provider if you have any specific questions about any medical matter. Is there a particular subject you would like to know more about healthy living after 50? Leave us a comment and we'll be happy to put together a video. Keep an eye out for our next video, and if you have learned anything from watching, please support our channel by giving us a like, subscribing to our channel, and hitting the notification bell.